Sure. So in this meeting, we will present the results of the phase 1 clinical trial that looked at Belantamab mafodotin, which is an anti-BCMA antibody drug conjugate in combination with Carfilzomib, Lenalidomide, and Dexamethasone for patients after 1 to 3 prior lines of treatment. And those patients got enrolled in a phase 1 fashion dose escalation trial. So we started with 3 patients. We saw one DLT in the first patient, and then we enrolled another 3 patients. We cleared the first dose. We moved on to the second dose of 1.9 milligrams per kilogram, which is it seems to be the recommended phase 2 dose. We also enrolled patients into 6 extra patients to expansion cohort to confirm this is our selected dose. The combination of Belantamab mafodotin with Carfilzomib, Lenalidomide, and Dexamethasone showed acceptable or manageable eye toxicity with low infection risk, which is promising for patients who are receiving BCMA-targeted treatment as compared to other monoclonal antibodies or CAR-T treatment. Altogether, with the deep responses that we achieved and the acceptable and manageable adverse events, those results are promising for us, and we are planning on proceeding with the phase 2 portion of this trial. Phase 2 portion will be a multi-center clinical trial that will include patients with high-risk multiple myeloma, newly diagnosed patients, transplant eligible or ineligible, and we plan on incorporating Belantamab with KRD plus stem cell transplant and then prolonged maintenance for those patients. So we're hoping to push this regimen to newly diagnosed patients. The first portion of the trial enrolled patients with relapse refractory myeloma to establish the maximum tolerated dose. But the eventual goal is for patients with high-risk disease. Patients with high-risk multiple myeloma have seen few improvements in their responses and survival, and we're hoping with addition of Belantamab mafodotin to the KRD backbone, we will achieve deeper responses with better survival for high-risk myeloma patients. If we use BCMA targeted agents in the front line, that will affect our next line for sure. However, if we're using Belantamab mafodotin, we have good data showing that you could still target BCMA after progression for patients who progress on Belantamab mafodotin. However, for monoclonal antibodies, that might be a different discussion.